I am Dr. Thomas Nichipadam. Today I will be talking about one of the most important aspects of dentistry, wherein you replace your tooth, natural tooth, with an artificial one, which is called as an implant. Most of the people are mistaken. Most of the people think that any replacement of tooth is by implants. Thanks to the marketing companies which do market a lot of implants, they say that implant is the best. Yes, I do agree that implant is the best, but are all implants the best way of putting tooth back into the original area? No. Is it the only way to put the tooth back in that area in a fixed way? No. But why is an implant very important in restoring back the function of the tooth? Because it mimics the natural tooth in its function. Why? Because when an implant is put in, the tooth or the crown is fixed onto the bone using a prosthetic replacement of the root itself. As we know, tooth has two parts, that is the crown or what you see, and you have a root where it is fixed to the bone. Just like that, in an implant case, we put a root inside the bone first and then put the crown on top of it. So it restores the contours of the bone, or you have the gums area which is little rounded because your root is inside there. So what happens is you restore that bony contours. Where what happens as soon as the tooth goes off? If the tooth goes off, if there is a tooth and if you have removed it, in the years to come, what will happen is you will lose that bone which supported the tooth because there is no function at all. Wherein when you put an implant back there, the function of the bone is still there, so the bone doesn't go off, or you will have the bone in its full volume. So it will be much more pleasing to see. You will not see a dip on your gums at all, or even if you open your mouth and smile, if you show your gums also, you will not have a dip in the gum and show it at all. But is it the only way to replace? No, we have bridges, we have crowns which attaches to the rest of the tooth and then put it on, and the tooth is fixed to this crowns. That is called as a bridge. That is also a fixed type of replacing tooth. But what happens there is you need to remove some amount of tooth structure from the neighboring tooth and then fix it. So the good thing about implant is we will not touch the next tooth at all during or after the treatment is done. So it will give a good natural tooth on the neighboring side, and we will be putting a pressure onto the bone, so the bone will also stay. So we are not removing the natural tooth which is next to it, nor we are removing the bone which is there, which would have gone off if we had removed this, if we had removed this tooth and kept it just like that. What do we have to know about implants? Implants is just like root which is there, so it should look almost like a root inside. You have enough number of implants which we have tried all over these years. It has been a science which grew all through this around 40 years. We have been doing implants and implants and implants. We have tried many designs, so it has to look like a root, because the natural design of God has to be still maintained, because it is naturally done. He is a master designer, so you put a root like structure inside your bone so that the pressures will be exactly the same on the bone, so the bone will react as it was designed to be. So you put a root forming implant inside there. Then what we should know about it? It should not eat off the bone, or it should have enough bone on both the sides. So either we need to increase the bone width if it is lost, or we need to graft and make a bone around the tooth. There was a loss of bone which is there, which has to be grafted, or you need to put artificial bone there and make it grow so that you can place an implant there. Okay, and the size of the implant, you should not put puny things there and then put a large crown on top of it, and so that you will be able to chew. It is not possible. People say that it is possible, it is made of very hard one. All implants, if it has to stay, it has to be done with titanium. So it should not fracture. So you need to put a good implant wherein you can support well or you can chew well. So after everything you should chew well. Okay. So you need a good implant and it should not be connected to the neighboring tooth. If you are going to connect it to the neighboring tooth, why then put a implant? Because you can easily do a bridge, because why you are spending money? So it doesn't worth it, it is not worth it. So implant should stay by itself, it should not be connected to the neighboring tooth. And how it can be used? See, if it is a front tooth, you can use an implant, or if you have lost so many tooth which is there in your mouth, or all the teeth are loose, then we can put an implant and put a denture on top of it. Or if you have lost everything and if you really want a bridge there, or if you want a bridge back and if you want to chew on a just like natural tooth, then also you can put multiple implants, around 8 to 10 in the upper or 6 to 8 in the lower. You can put all the teeth back without removing it. You can normally chew and you can just be like you had the natural tooth there. It is not just like putting a screw inside your inside a wall or anything. It is a natural thing. You don't make a big hole on your tooth. Some people are scared that you make a drill and make a hole. It is not like that. We just make an osteotomy or a small preparation so that the implant can go inside. It is not about drilling and putting and all that stuff. It is not a screw at all. It is a root form, or your tooth is not a screw at all. Just like that, it is a root form which goes inside the tooth and it gets integrated. The beauty of the titanium is once you put it inside your bone, what happens is it becomes one with bone. You will not be able to take it off because the bone and the titanium becomes one unit. It is not like your tooth even. The tooth has periodontal ligament or a ligament which attaches everything together. So that doesn't happen. Here the bone gets attached or it becomes one unit with the implant. So even if you want to remove an implant, what you have to do is you have to cut the bone and then remove it. You cannot take this thing and remove unless it is got infected and then it comes out. So it is a very good way of replacing the tooth because it's firm. You can chew on it. You can smile because you will have enough bone. It is not affecting the next tooth because you are not touched the next tooth at all. So it's a very good way of doing it. But before that, we need to check out whether you have any diseases, whether it will be taken up, and the material should never be other than titanium. There are ever so many materials. You can put any screw inside your bone and expect it to stay, but it doesn't stay because titanium is the only one which gets attached to the bone. So a titanium implant has to be used and it should be taken from a very good company so that it is well treated well, so that it gets attached well. The surface should be well treated because it's bone, because it's once again inside your body. So you have to keep it you have to select well. The case should be good, the bone should be good. If bone is not there, you have to make bone, you have to wait for the bone to grow and then take it. It is not a simple game at all. So it has to be done with a good implantologist, a good implant surgeon, and the top of it, the crown which is placed, also should be done by an expert who has done implants. It's not just like putting a crown on your tooth. So it has to be designed well and put it on top. It's an extremely good way of replacing tooth, but take care, you go to a good one. It's not to blame that the science is bad. It's always that you go to an expert so that you get a better treatment. You should not say that implant has failed, I have no hope. No, implant has failed because either the implant is not good, or the selection is not good, or the doctor is not good. So make sure that you are the good patient for implant. You have gone to a good doctor and you have selected the good implant. It's not about cheapness of the implant, it is all about life of the implant. So get it done, smile well, put it back, but with care you will get a very good result. We have seen some of my professors which have done, they have done up to 35 years of implantology, wherein they have excellent results. It's not that failures are not there. If you have to maintain it well, you keep it well, just like your natural tooth, you keep it and maintain it well, you will definitely have a good smile. Implants are good, implants has to be done. Before that, we have to look into your blood dyscrasias. What is blood dyscrasia? Or if there is any problems with your blood, if you have bleeding disorders, if you have diabetes, if you have any infections which are there in your body, please don't do implants, because implants need healing. If you have diabetes, you can do implants, but it has to be controlled really well, because healing has to take place. Healing take place, then what will happen is, then even if you have diabetes, it is just like your tooth, you have to clean it up and keep it. So you have to control your diabetes to a very good extent. It is not a permanent replacement, because this also is inside your body. It can also get infected. So maintenance of an implant is very, very important, because it's just like your natural tooth. If it is not maintained well, it will fall off. Your natural tooth fell off because you didn't maintain well.